Thank you, Brandon, and thank you all for joining us today for our 2018 webinar, From Data to Policy Development, Tobacco Control Tools You Didn't Think You Needed. I'm Kerry Cork, a public health law attorney at the Tobacco Control Legal Consortium. We have 3 speakers and a lot to cover today, so I'm going to keep my opening remarks brief. I'm excited about this webinar because even though I've worked in tobacco control for some time, I just became aware of a few of these resources fairly recently and can't wait to share them with you. This is a webinar designed for anyone who may be looking for the latest U.S. federal, state, and local health, legislative, and related data and tools to support your work. Regardless of whether you're working in local, state, or federal tobacco control and public health, and whether you're a public health advocate or professional, policymaker, researcher, attorney, or just someone interested in learning about handy new resources on tobacco control, we think this webinar will be of interest to you. I'd like to start by saying that this webinar is sponsored by the Public Health Law Center's Tobacco Control Legal Consortium, our national network of legal centers and attorneys that support tobacco control policy change at the local, state, and national levels. We do this by providing free legal technical assistance to tobacco control advocates, public health professionals, local and state health departments, coalitions, government, and private attorneys and individuals. Finally, our organization is committed to the principle that good public health cannot be achieved without addressing equity. For more information about our organization, please visit our website at www.publichealthlawcenter.org. So, as I mentioned, I'm Kerry Cork. Part of my job at the Public Health Law Center and the Tobacco Control Legal Consortium is to provide legal technical assistance on tobacco-related issues around the U.S. I'll be moderating today's webinar. I'm delighted to introduce our presenters today. Our first speaker is Brandon Kenemer, a public health advisor at the Centers for Disease Control and Prevention. Brandon is a public health analyst at the CDC in the policy unit of the Office on Smoking and Health. Brandon provides analysis in the planning, support, and coordination of national initiatives to align program goals with the center and division strategies in tobacco prevention and control. He has 8 years of public health experience as a public health analyst and subject matter expert in tobacco control surveillance systems. Our next speaker is Lucy Culp. Lucy is a state and community advocacy advisor at the National Center of the American Heart Association and American Stroke Association. In this role, Lucy offers policy guidance, technical assistance and training, and campaign strategy to the association's government relations staff across the U.S. on issues related to tobacco prevention, health insurance coverage, and access to care. Lucy is a Washington State native and University of Washington graduate. And our last speaker is Desmond Jenson, a senior staff attorney at our center's Tobacco Control Legal Consortium. Desmond works primarily on shaping federal tobacco control policy by encouraging the Food and Drug Administration to enact strong tobacco control regulations based on its authority under the Family Smoking Prevention and Tobacco Control Act. Desmond also educates the public health and scientific communities about the rulemaking process and highlights opportunities to engage the FDA to create better regulation. He helps the public health community in its efforts to close regulatory gaps and enact novel regulations that anticipate future regulatory issues. Desmond also provides legal technical assistance to members of the public health community who wish to participate in the regulatory process, and he provides litigation support to defend tobacco control policies that are challenged by the tobacco industry. We're covering a lot of information in this hour, but we're hoping to have time to respond to questions at the end. Our agenda today will start with Brandon giving us an overview of CDC's state system and OSH data web pages. Then Lucy will walk us through ways we can use this wealth of data as a tool to advance tobacco control policy and initiatives. And finally, Desmond will talk about several key resources and publications on the Public Health Law Center's website. Please send in your questions at any time by clicking on the Q&A button at the bottom of the Zoom window. And with that, then I'll hand things over to our first speaker, Brandon Kenemer. Brandon?
Can you hear me, Kerry?
Yes, Brandon.
Excellent. Okay, and I'm going to share my screen now. Can you see the state system?
Yes.
Awesome. Wonderful. So thank you so much for having me today. I'm delighted to be speaking and have the opportunity to showcase some of these surveillance tools here in the Office on Smoking and Health. So in addition to researching the health effects of tobacco use and identifying best practices in tobacco control, as well as helping fund state efforts to address tobacco use, educating the public about the impact of tobacco use and exposure, and running the TIPS campaign to connect people who want to quit with cessation resources. CDC also supports state tobacco control activities by collecting data about tobacco use and tobacco control policy efforts. And so the State Tobacco Activities Tracking and Evaluation System, or state system, and OSH data are two examples of how we here in OSH collect and disseminate data online. And if you think of OSH data as a cloud-based open data environment, essentially an online user-friendly database, and then state system is an application or an app that plugs into OSH data and streams the content directly to the website when updates are made. So for today's demo and for time's sake, I'm going to focus primarily on the state system, but I'm open to questions later in the Q&A session on OSH data later in the webinar. And I'm going to start off by highlighting data using multiple report options here on the site. And then I'll walk through how other resources in state system can be leveraged to use these data. So first and foremost, how do you get to the state system? So you can simply type cdc.gov/state system into your web browser, or you can access the state system from a link that's on our cdc.gov/tobacco homepage for the Office on Smoking and Health. And so what you're seeing now is the state system homepage that you would arrive on if you clicked on that link. And you see we have a carousel here that will help you navigate the site for some of our more popular report types, as well as some of the resources and other materials that are using the state system data and fact sheets and slide decks and such. So right here on the lower portion, you can see the three icons, and these represent the three different report options that we have in state system. So custom reports is exactly what it sounds like. It's a custom report where you would build your own report by selecting different topics and measures. And think of this report as your go-to for comparing across multiple locations and multiple indicators. And then the state highlights report, the blue icon, is really a location-based report where you have one location and multiple indicators across the system compiled in a very visually represented format. And then the interactive maps portion is primarily for comparing across states or other locations for a single indicator with the latest data available. So to kick it off, I'm going to walk you through what it would be like to search for one indicator for continuity's sake. I'm going to take you through cigarette excise tax in each of the reports so that you get an idea for the display differences, but also what each report offers. So on the custom reports page, you'll see that there are filters and options for different topics that we have available in state system. And for cigarette excise tax, I'm going to click on legislation. There are other ways to get to this information if you weren't sure about what topic to choose, and I'll walk you through that in a moment. But when you click here, you'll see all the available topics under legislation that are housed in state. And these are separated out by traditional tobacco use, and then we've added e-cigarette legislation separately as an expansion to the system last year. For this, I'm going to click on tax combustible tobacco to get me down to the combustible products that we have in state, and then cigarette. The submeasure for this one, we only have one submeasure, so I'll select cigarette tax, and since I'm in Atlanta, I will choose Georgia. And then the years available on the report State system for legislative data, we have data dating back to 1995, Q4. So I'm going to choose the latest data point and the 95, our first data point in the system. And then you'll view the report. Essentially, the output from the report are two rows that I've requested. And what you're seeing here is the actual code for the bill or citation that's associated with the excise tax or the legislative indicator you've chosen. We see that in 1971, there was a cigarette excise tax bill enacted in April. And then in 2003, there was an update where we raised in Georgia our excise tax to 37 cents. You can take these rows with you in Excel if you wanted to export them. And I would recommend that if you do have multiple indicators, the output usually caps you at 25 rows per page. So you'd have to navigate through several pages, and Excel's a much more friendly way to navigate large sums of data. But now that we've seen that output, I'm going to take you back to the homepage each time and navigate back through so you understand kind of where I'm going at each touch point. But for the state highlights report, I'm going to dive in here. And when you click on the state highlights report, you'll notice that there's a click map. And essentially, you're going to choose what location you want your state highlight report for. You'll also notice that we've added in 7 territories. These deployed to the system just in January last month. So these are fairly new. And we're working on expanding territory data, legislative territory data, to most of our other materials that I'll walk through later. If you are curious as to what topics and sources are associated in state system, below we also provide the different panels and sources associated with those the topics in the state highlights report. So scrolling back up, I'm going to go through Georgia. If you navigate through the click map, it will auto-generate your state highlight report for that location. And every state highlight report defaults to the first tab, which is health consequences and cost data. There are several different views that you can choose in this highlights report, and each one is interactive. You can hover over and get the actual data point. If you are interested in seeing these data as a table, you could click on the table icon in the upper right corner, and the panel will essentially pivot into a different display that may make it more user-friendly for you to view or snip into a presentation. We also have options for data such as our smoking attributable expenditures here, where multiple data years are available. So if you did select other additional data, most of these panels will pivot to the most recent 5 years available if that data source has 5 years available. And so this gives you just a couple of examples of the view types that you can find in the highlights report. But going back to our excise tax, I'm going to click on our legislative topic. And you may have noticed that these topics are consistent throughout all the report options in state. So once you've located your indicator, you can always know that it will be under either legislation or tobacco use adults if that's what you've been looking for. But we have aligned those consistently throughout these reports. And so as I scroll down, you'll see here the first data point is the cigarette tax dollar per pack at 37 cents that we saw on the custom report. But what this report brings that custom reports didn't is a very user-friendly visual way of laying out comparison across multiple indicators. And for this example, you can compare multiple combustible tobacco products and tax equity or inequity across both combustible and non-combustible products. So you'll notice here that most of the products are taxed at 10% of wholesale cost price in Georgia. However, cigars, little cigars, and cigarettes have different taxes. And as you scroll down through the legislative report, you have other policy data related to comprehensive smoke-free indoor air, our tax stamps and high-tech tax stamps, a preemption summary, smoke-free campuses, and our youth access data and licensure data. So these are the panels we've chosen to display. And I should note that these are all for mostly cigarette use and traditional tobacco use, but we are adding e-cigarette panels to the report in the coming months, where you will be able to pivot this legislative tab over for the same indicators, where it would show legislative information on e-cigarettes. One feature of this report too, and I believe another speaker, Lucy, may highlight this as well, is you can take the whole report, all the panels with you in a nice PDF. So if you were to click on the all highlights link up here, you would essentially get a report like this in a PDF, and everything's nicely laid out. All the data points are there for all the indicators available for that state. If you just wanted to hand it out to someone, or you wanted to take it with you as a quick reference point. All right, I'm going to go back now to the homepage, and we'll navigate through the interactive maps. So on the interactive maps page, we have several interactive maps that have data associated with multiple topics. And these are usually our most requested topics, but we definitely take feedback from our users to try to post things that we feel like would be most often requested. And for this, cigarette excise tax on rates on packs of cigarettes is the map that we're going to look at today. And when I click on the map, you can hover over each one of the states to get the immediate excise tax. The maps are all updated as of the latest date. So our last quarter closed December 31st, and the data were updated by January 4. And then the map is dynamic in that the ranges are true min and max ranges. So the lowest tax is 17 cents. And the highest tax is $5.10. And when you scroll down through the website past the map, you'll notice that the alpha order is set on the table, but you can also sort by each of the columns. So if you wanted a range or a comparison across states for multiple excise taxes, you can see kind of where each state falls. You can take this data with you as well through an Excel or CSV export. And there's a link to the full data set if you were interested in data back to 1995 through 2017. All right, and scrolling back up. And before I get too much further into the site, I just wanted to point out the latest updates feature here. This is updated on a mostly monthly basis. We deploy data updates or functionality and formatting updates that we've heard from users would enhance their experience. If you click there, you'll notice that in January, we had a pretty heavy release for new data that are available in the state system, but these updates go back all the way to July of 2015, where we deployed the site as a whole in a redesign. So every update that's made to state system, if you're curious or want to look back at a particular indicator to see when it was last updated, is all stored here historically for your reference. The report guide, as you scroll down through the homepage, is essentially a layout of providing you information about the report options that are available with each indicator or topic. So if you click on the report guide, and you may come to state system and not know necessarily what you're looking for or what's available, you can click on one of these high-level topic areas, and then it will provide you a table and an outline of the materials that are associated with each one of these topics. So for tax on combustible tobacco, you can see that the cigarette indicator here has an interactive map, and it's the only one in this topic category that does, and that's the interactive map that I just demoed. So for every topic associated in state, we have these kind of colorful tables that just denote whether a report option is available for you, and you can click right to it from this report guide rather than having to filter through multiple systems or sites. All right, and glossary and methodology, I just wanted to point out, if you get an indicator from the state system, each one of our measures and submeasures are very clearly defined. So the glossary and methodology page will provide you a resource either directly to the original source information or a glossary file that's stored in our open data environment, which we call OSH data. If I were to click on the Glossary and Methodology link for legislation, it would take me into the open data environment where I could then download the methodology file. And I've downloaded it before and filtered it for convenience, but you can see here that the cigarette provision, dollar per pack, now is defined as the total state excise tax collected in dollars per pack of cigarettes. And then any valid value that you would find in state system is very clearly defined. We have the methods for how we've collected information on coding mechanisms for preemption, for instance, case law information, a state system overview, what legislative and statutory information is included and what it isn't included in state system. And then the source information if you wanted to cite a data set or a particular source in state system. And then when we last updated this glossary file. So that's a helpful resource if you're trying to lock down a particular measure and you're wondering how exactly we came to the conclusion of that coding. And just very briefly, the FAQs, if you do have questions on how to navigate both this site and the OSH data site, these FAQs are very helpful resources to help guide you through any troubleshooting you may have. But as always, please feel free to contact us if you have questions and we can help and provide TA as well. So on the lower portion of the website, you'll notice that we have fact sheets, slide decks, quick start guides, all these colorful handouts. I'll walk through an example of the fact sheet that we have available for excise tax. When you click on fact sheets, you get links to 10 associated legislative fact sheets stored in our open data environment. And if there are other reports that are in state system aligned with that fact sheet, then we provide a link to you for a more dynamic experience online. For the excise tax fact sheet, I would click on the link to download this fact sheet. And it would take me to the open data environment where I can then preview the fact sheet to make sure that this is what I was looking for. I've already downloaded this one to give you a kind of high level overview of what's in each one of these, but all of them have a map and associated science with that particular topic. If there's a healthy people objective that's aligned with this topic, we also provide the latest status associated with that. All the definitions for each of the products that may be discussed, and data tables for all of the states, DC, and territories. Some of the territories are available in these fact sheets, and we're expanding 4 additional ones currently, so those should be out next month. But this is a very quick and easy way to export essentially all the data we have in state system into one 8-page fact sheet that you can take with you. Some of them are 2 pages, some of them are 4, but the excise tax one is definitely our maximum. All right. I'm just going to go back to the home page now. And when I'm scrolling down the slide decks, we often got requests for presentations where people wanted to use our either maps or data associated with a particular topic in their presentations or even internally here at CDC. So we've queued up a couple of our very popular topics, youth and adult cigarette use, as well as comprehensive smoke-free indoor air and excise tax. And so for the excise tax map that we were looking at earlier, there is an associated slide deck that you could download. And it would look something like this, where you have a title slide and when it was last updated. You have an image of the map and a source. You have a chart associated with the data, or you have a different kind of graph if appropriate for that indicator. And then you have a data table that lays out each one of the excise taxes for states and territories. And you can link users in your presentation directly back to our open data environment for the full data set, or directly to the map or state system itself. And it comes with source information for you to cite already queued up in this presentation format. And so lastly, I just wanted to highlight these publications and features from the Tobacco Use Data Portal. These publications are some of our latest released MMWRs or journals where state system data was the primary data source used in those publications. And then the features from the Tobacco Use Portal are some of our most clicked on features in the open data environment. One such infographic that uses state system data with a nice colorful view is kind of this nice layout for a Going Smoke-Free Matters on Bars and Restaurants infographic series. And we have associated infographics for the Going Smoke-Free Matters series stored in open data for multi-unit housing, for in your own home, for other areas as well as casinos. And so you can also get the latest kind of state of the states here. And this is a just front and back handout that our users, especially those at the Americans for Non-Smokers' Rights, have given us some very positive feedback about how these are received. And so I'm now going to just pause and hand it over to Lucy Culp with the American Heart Association to provide some examples of how this state information paired with local data can help to inform tobacco control policy activities and initiatives. So I'm gonna stop sharing, and all yours, Lucy.
Great, thanks, Brandon. Can you all hear me okay? Or can you hear me okay?
Yes, I can.
Excellent, okay, thank you. So hopefully you can see my screen as well. So hi everyone, I'm very excited to get to connect with you all today. In my role at the AHA, I really serve as the issue lead on our tobacco prevention policies at the National Center. So I work directly with our staff and many of our partners in all 50 states, in hundreds of communities at the federal level. So as you can imagine, I hear a lot of questions about varying policies, regulations, data, how it compares state to state. And I think, as you could see from what Brandon walked through, there's an incredible amount of data here at our fingertips. And rather than try to walk you through the site, because I am not the expert by any means, I wanted to just highlight some key features, and already went ahead and pulled a few key pieces that I thought we could talk through. And just give some ideas and highlight some few areas where I think the data that's here and so easily accessible can really help to further our work. So I am going to start with one of the state highlight reports, not from my home state of Washington, but from my news home state of Florida. So as Brandon went through kind of the website version of this, you were able to see really the plethora of data that's available here, but I went ahead and exported one of these reports so you could see kind of what that PDF looks like. And again, this exports at 15 pages, so it is comprehensive. This is no joke. There's a lot of information here. So it really starts with the health impact and cost, and I'm going to try not to scroll too fast so that doesn't look too crazy as it's coming through on your screens. But then moves into to tobacco use data, both by adults and then kids, as it's available. So we're going to skip these pages because we're missing a little bit here. Then gets into policies. So we're starting here with smoke-free policies, which, much to my dismay, moving from Washington to Florida, we sadly still don't have a comprehensive smoke-free law. But you can see some of the analysis here on smoke-free, which is great. And then moving into the legislation that does exist in the state, looking at taxes, again, smoke-free, preemption, a popular policy here in Florida, licensure, and then youth access. And then the report goes on to walk through cessation coverage. So you can see really lots of data here. Funding for the program, and then quit line. So again, you'll see there's a lot here. It's, I think, very comprehensive. Really that one-stop shop for data in your state. Maybe not something that we would always hand directly to someone who doesn't do this work day in and day out, but that great source material for the education that we're all doing for sort of the variety of our stakeholders and the different groups that we're talking about. But really sort of that, I could see state advocates having this printed out and available with them all the time, because there's just this plethora of data kind of right there at your fingertips, ready to answer any kind of question that gets thrown at you. So the next thing I want to go to is one of the custom reports. And I want to zoom out a little bit from just my corner of the country here in Florida. And one question that we hear a lot, and I'm sure you all do too, is how does the state compare? When you're working in any given state, you know, with policymakers, with stakeholders, it's okay, we can do that, but what are our neighbors doing? How does this compare, especially when we talk about tax policy? So I thought we would look at a report on e-cigarette tax policy. So here you can see in the topic type, we do legislation. For the topic, we do e-cigarette tax. And again, there's a lot of options here, but I thought e-cigarette tax would be a good just example for us to look at. Measure, we look at e-cigarette tax. For sub-measures, I just checked them all because I wanted to make sure we had a, sorry, I'll scroll down there. We had a really comprehensive look. For location, I just wanted to pick some of the neighboring states. So I did Alabama, obviously Florida, Georgia, Louisiana, Mississippi, and South Carolina. And then for a year, I just did the most recent year, so we could see kind of what is the current state of things today. And as we scroll down, you can see the report as it becomes available just right there on the site. And you can scroll through the different pages, but you are kind of limited on how much will show up. Uh-oh, well, the cool thing is I already have this downloaded. So the nice thing is you can actually export all of that data to Excel, and then you have it available here. And so what we see is that, in fact, of those states, Louisiana is the only one that currently has an e-cigarette tax policy. But we've got this nice kind of way of comparing the information across states. So the next thing I'd like to take a look at is over here, one of the PowerPoints. So zooming out even a little further than Florida and our surrounding states, and again, because I'm still lamenting our not quite comprehensive smoke-free policy, I thought we would look at the map for smoke-free and how that comes as this pre-populated, already created PowerPoint, which is obviously very handy when we're on the go. So here we have this first slide that I just wanted to show that has the map, you know, all color-coded, kind of, again, showing hopefully a kind of a broad range of the information, and that quick snapshot, and again, already available in a PowerPoint. And then going to the next slide, provides just, again, that quick snapshot of this policies by state. And so it's a little small, I know, even on my screen, so I'm going to zoom in, but you won't be able to see everything, just to hopefully give you a better sense of what this has here. But it's that information state by state. So type of restriction, private work sites, restaurants, bars, for all 50 states. So, you know, again, I think just that the handiness of kind of having this all available, ready to go, you know, can pick up and run with it as you need. And then, like with everything else here, we have the sources, easily, you know, easy to grab, easy to cite on another document if you need it, but just very accessible. So the last thing I want to show you, again, sort of, we'll move away from Florida, but I want to go back to our e-cigarette question at the beginning and take a look at one of these fact sheets. And so let me scroll all the way back up to the top. You know, I think we can see these being a really helpful resource as you're diving more into the weeds on specific policies. So the fact sheets really start with this sort of high level, you know, the trends, the health information, kind of that 10,000 foot view of kind of what we're dealing with on this issue. What is an e-cigarette? Important thing to be able to answer, right? And then as we kind of scroll down into this, it gets more in detail. So here we have legislative activity, and it's, as you can see, kind of separated into these buckets. to really give you a sense of what the trends are, what states are moving in what direction, and kind of what the legislative landscape looks like. And then continuing on from there, we have more maps, which is just a great way to be able to see kind of side-by-side comparison of what states are thinking. And in each one of these areas, each one of these policy areas, we get a map and then a chart with more detailed information. So on this e-cigarette report, we have, again, starting with restrictions on sales to minors, going to licensure, indoor air, sorry if this is scrolling too fast, e-cigarette taxes, and then last we have the glossary terminology. And I know Brandon mentioned this, but I just want to flag again how handy this is. While many of us may not be clinicians or experts necessarily in some of the details on e-cigarettes, I think often as advocates, we become the experts for those we're educating. So I think this type of resource can be really helpful in kind of grounding us all in the same language and the same understanding of the policies and the products that we're talking about. And then lastly, on this, as well as the other resources that I mentioned before, is that we have the references here. And again, I think this just helps. I can't say enough how user-friendly and handy a lot of this data is, and especially having these resources or the references here that we can just grab and cite in other places as needed is particularly helpful. And I think with that, I can wrap up and hand it over to Desmond Jenson, and would really just encourage everyone to poke around the site, check out the info for your state and region and the issues that you're focused on, both today as well as into the future. As we're working together to educate the public and policymakers and advocates and other partners, I think these tools can serve as a powerful and luckily very easy to access source of data about the policy landscape and kind of the work we have ahead of us. So thank you again for your time today. I look forward to any questions and being able to connect with you more. And I'm happy to hand it over to Desmond.
Thanks, Lucy. I'm really excited to show off some of the great stuff that we've added to our website recently. And I can tell you there's more on the way. So I'm going to highlight two major resources. And they're just the first in a series of things that we're planning on doing this year. Now, if you want to be in the loop on all of the upgrades on our website, you can connect with us on social media and subscribe to our newsletter. You'll find the links to that at the top of the page of every page you're looking at on our website, right next to the search bar. The Consortium bulletin goes out about once a month. And you can, if you subscribe to that, you can stay up to date on important legal updates in tobacco control. We also highlight our newest publications and our upcoming webinars. So if you're not subscribed, you should definitely do that so you don't miss out. Before we dive in, I want to make sure that you all know that the Public Health Law Center is not just about tobacco control. I'm sure many of you work in other areas related to chronic disease prevention. And if you don't, you probably have colleagues that do. And we have tons of resources on healthy eating and active living policy on our website as well. I'll just highlight that my colleagues have done a ton of research on policies related to childcare, including some 50-state reviews of policies and licensing laws. And that's really just the tip of the iceberg. We have lots of other resources on healthy eating and active living policy as well. So I'm going to dig in. I'm sure most of you have probably been to our website, maybe everyone on the webinar. So I'm not going to click through every resource we have because we have literally hundreds of publications on just about every policy and legal issue in the realm of tobacco control because we've been doing this for almost 20 years. But I do want to highlight some of the things that hopefully you didn't miss but are fairly new. And we're going to start with e-cigarettes. Oh, by the way, you're going to see me using the drop-down menus on our website and then sometimes clicking on some of the links over on the right side. That's going to be your main way to navigate our site. If you're not finding what you're looking for, you can always feel free to use the search function. And if that doesn't get you to where you're hoping to go, always feel free to call us or email us and we'll help you find the resource that you're looking for. So again, we're going to start off by talking about e-cigarettes. A little while back, we decided to be proactive. And so we developed a tool with the help from our colleagues at the Public Health and Tobacco Policy Center. We've pulled laws regulating e-cigarettes in all 50 states and the District of Columbia and put them all in one spot. So there's two ways to use this resource. First, you can click on your state or whichever state you want information about. And you can find just about anything you want to know. What the definition of e-cigarettes are they taxed, are there packaging regulations, sales restrictions, the minimum purchase age, retail licensure, smoke-free laws, just about any question you might have on e-cigarette regulation. And we've also included a link that'll take you directly to the statutory language for the official law for that site. If you are more of a research type, or if you just want to try to compare laws across states, we've uploaded our whole data set. You can go through state by state, compare all the policies that I just mentioned. We're incredibly proud of this resource. We try to update it quarterly. Our latest update was very recently, and it's for laws as of December 31st of 2017. So if you hit this resource at the right time, it's going to be really fresh. If you're looking at it right before an update, it's always possible that there's a law that's passed that we haven't gotten up yet. But if you check back frequently, again, we do update every quarter. So that's the first major resource that I want to highlight for you. The next is our newly renovated FDA Tobacco Action Center. Again, this is something we're really proud of. It's pretty new. You'll notice right away here on the left side, we're featuring very prominently the latest developments in FDA regulation. Over on the right side, we've got the latest developments in litigation. So in our current action items, you're going to find things that are under review by the FDA, things you can comment on, the latest news. So you can see we're highlighting some MRTP applications, modified risk tobacco product applications. If we go into the application for IQOS, you can see we have a summary of what's going on. We have a link to the FDA's website where you can get materials on the application, and we have the committee, the Tobacco Product Scientific Advisory Committee's meeting materials as well. And then, of course, we're going to link you directly to regulations.gov, where you can go and actually submit a comment on that application if you want to. So again, we're going to have new updates here. We are, of course, waiting for the opportunity to weigh in on the FDA's new regulatory plan announced last summer, including its plan to reduce nicotine in cigarettes, addressing flavors including menthol, and potential deregulation of premium cigars. We're going to add links to those items in our action items as soon as they're available, as soon as there's dockets for people to comment on. So on the other side of the Action Center, again, we've got litigation developments, and most of the developments in litigation are related to the FDA's deeming regulation. So we've actually put a list of all of the cases on our website, and then the information you might want to know, like who the case involves, whether we or any of our partners have been involved in litigation, and what to expect next. At the bottom of this page, you're going to find a link to another document, and this view resource button actually goes at the same spot. I should mention also, a lot of our resources have this share button, and you're always free to share our resources on social media. If you want more in-depth information on this deeming litigation, we do have this fact sheet that also gets updated frequently. So this dives into more of the details of what actually has happened in the case to date, and we actually break down some of the legal arguments as well. Again, that fact sheet and this resource get updated frequently as soon as there's updates. So if you want to know what's happening right now, the FDA Action Center is your place to go. So if you go a little bit further down the page, what you're going to find is 3 particular subject areas that we highlight as well. These are topics of particular importance to us and the rest of the public health community. We've done lots of work in these areas, and we have lots of resources on these topics. So we've highlighted menthol, e-cigarette regulation, and the FDA's pre-market review process. So when you go into each of these pages, you're going to find lots of publications, you're going to find past webinars, and any other material that we have related to that topic. So as you can see, menthol and cigarettes has been one of our top priorities for a very long time. We have tons of information on the impact of menthol. We have our citizen petition to the FDA demanding action, and we have tools for state and local governments as well. The next section back on the main page, we actually have all of our publications collected. So if you just want to know what we put out most recently, we have all of our fact sheets. We publish all of our comments to the FDA. We have our citizen petitions, our archive webinars, everything FDA related is right there with the newest stuff right on the top. Before I turn things back over, I just want to highlight a couple of other things on our website, just to show you some of the breadth of the resources that we have. So we have put a lot of time and effort into HUD's smoke-free rule and the implementation of it. We have a lot of resources related to that, and we're still developing new resources as the rule gets implemented. But if you're working on that, this is the place to go to for that. We also, our own Kerry, Cork, has developed tons of resources related to housing for special populations, including assisted living facilities and tobacco use among the homeless. We're proud of these publications as well. I'll also highlight for you that all of our webinars, just like today's, are archived on our website. We put out about a webinar a month. We try to pick timely and important topics, but if you miss one of our webinars, you can always go back to the very beginning, in fact, to find out, to view webinars that we've done in the past. We try to put up slides and videos of each webinar. Finally, just to wrap up, I just want to let you know that very soon we're going to be updating our page, our web page that holds all of our amicus curiae, or friend of the court briefs that our organization has filed over the years. We're excited about that, and we'll be announcing that update after it's complete. And then the one last thing to mention of is that while we're really proud of our publications and resources, that's only part of what we do. So publications are great for general questions, or if you're looking for an overview on a topic. But when you have detailed questions or you're working on changing a specific policy in your community, you can always call us for help. So as Kerry mentioned at the beginning, we're funded to answer your legal questions related to tobacco control policy, and someone is always available to help you out. So you can call, email, or send us a message on social media with your question. We have more than 10 full-time attorneys that are devoted to tobacco control and who are on call for you. I'll turn it over to Kerry.
Great. Thank you very much, Desmond. And let's see, can I advance here? Okay, before we go on to questions, I just want to display the website locations again of the CDC's state system, the OSH data website, and the website for the Tobacco Control Legal Center. And the Tobacco Control Legal Consortium and the Public Health Law Center. And also, if you'd like to subscribe to either the consortium's bulletin or our legal update, which comes out biannually, just shoot us an email at the address located. So we're ready to address questions. We hope folks will be sending us the questions now. So we'll wait, I did get one question a little earlier, and I guess this goes to you, Brandon. How do you get a full data set? Where would I go and how would I get it?
Hey, Kerry, can you hear me?
Yes.
Excellent. That's a great question. So let me share my screen and walk you through just an example of how to get a full data set. So if you're on the homepage, Kerry, can you see the homepage on your view?
Yes.
Okay,
yes.
Great. If you scroll down to the tobacco use data portal icon down here, you can link directly into the filtered version of our open data environment. This website, I should note, is it houses all data for the Chronic Center at CDC. So you will find other topic areas like heart disease and stroke prevention, maternal and child health, oral health, all in this open data environment as well. So if you are interested in comparing data across multiple topics, 500 cities, or chronic disease indicators may also be a resource that you can use within the same environment here. But when you land on the tobacco use data portal, you can quickly search for what you may be looking for. So if it was that tax data set and you were here, you could search for the tax just by entering that. Or you can scroll down to these tags where we've tagged all of our data sets with relevant either sources or topics. And if it's tags that you're interested in, if you scroll down through each one of these tags, you'll see that there are 19 views associated with that tag. So I can click on tax and see what comes up. And here you'll see we had 19 results with the tax burden on tobacco, our latest volume in 2016 that was released. This would be the tobacco legislation tax for the indicator that I was looking at earlier, and the fact sheet that I was demoing earlier as well. So when you click on a data set in the open data environment, you get a lot of information. And for a lot of people in state programs who aren't familiar with using very large data sets, we usually send them to our OSH data website or our state system website. But for those who love huge data sets with multiple millions of rows, this is probably a better venue. So you can view the data. You also get information about the data set, how many rows are associated with this data set, the columns, and a lot of this is language and coding that's used through application programming interfaces or APIs. So if you have programmers, they can plug into this data set and pull it dynamically. So anytime we would update the data, your application would be updated as well. And when you view the data, it takes you inside the data set itself. From here, you can export the data as a CSV or Excel file. You can also export it as an API if you were interested in programming. Say you got here, and these data actually contain future enacted or effective dates as well. So if a law was passed but doesn't take effect until 2019, for instance, you can find that in the data set, while in state system, we only show the latest full quarter that has closed. For more views, once you're in the data set, you can see if there are graphs associated with these data. There's a filtered table. Are there maps associated with these? And this is all housed within this same tool, separate from the state system itself. And say you got here and you wanted to filter specifically for maybe a year or an indicator, you can add a filter here, type in what year you are looking for, and the data set would automatically update. And then you could export it in that fashion. So that's just one example of a full data set. There are multiple different types of resources stored in the open data environment other than just data sets. So we do have PDFs, fact sheets, slide decks, but also feel free to email us at statesystem@cdc.gov if you have any questions or need some specific TA. Thanks, Kerry.
Great, Brandon. Thank you very much. We go back to our slides. And one of the questions we received had to do with our going back to this slide showing the location. So we've done that. We also had a question, can the attorneys that Desmond mentioned help with e-cigarette or e-juice regulations? And I'm going to have Desmond respond here.
If you are working in tobacco control, if you're a public health professional at a local, state, federal, tribal government, if you're working at an NGO, if you're part of a local coalition, if you're just on your own trying to fight City Hall, anybody who's working in tobacco control can bring their legal questions to us, and we will do our best to help you out. E-cigarettes, cigarettes, cigars, everything.
Great. Thank you, Desmond. All right. We're waiting. Oh, we just have one moment. We have a question. Why? Okay. The question is, why does Minnesota not have youth tobacco data? We have the school system questionnaire that has tobacco use data. And Brandon, I wonder if that's something that you could answer.
Yeah, absolutely. So we do get that question often, is why are you not using the data that we have available for a specific survey? And mostly the answer is that most of the data that's in the state system, the survey-based, is a CDC survey, and we use YRBS data in our youth tobacco survey, YTS, and those are the two sources that are stored in the open data environment, as well as in our state system. While we know that there are other sources, we just have not added those fully to the site because of the breadth of information that the surveys that we are using across states provide uniformly the data points that people are interested in comparing against most often. So if you do have a state-based survey, we often just try to tailor the message using national information from surveys, and then can assist with isolating any differences in your state-based survey and highlighting that data in tandem with the national data and state-level data provided in state system. I hope that answers your question.
Okay, thank you, Brandon. I have two quick questions right as we're at the end of the hour here. The one question was, do you help with ordinances such as Tobacco 21? And I'm assuming that's addressed to the Tobacco Control Legal Consortium, and the answer is a resounding yes, we do. And we have one final question, and it was the attendees wrote that she appreciated Lucy's highlighting the utility of pulling information from neighboring states, and she was wondering if Lucy would be able to speak to some of the differences in what audiences like to see or hear and how this information relates to that. So Lucy, is that something you could address, please?
Sure. Yeah, happy to. So yes, I definitely agree that that ability to pull data from neighboring states and sort of do that cross-comparing is very helpful, particularly with lawmakers. Oftentimes state lawmakers are competitive. They want to know what the neighboring states are doing to see if their state is keeping up or is falling behind, or if a state is sort of more proactive in passing policy. Sometimes that is not necessarily a good thing. They don't want to go the direction of another state. So we find that it's always just good, sort of good background information to know what your neighbors are up to and kind of what the status is in the states around you. But then particularly with tax, sort of the argument around cross-border sales and people going across state lines to purchase, that, those types of questions come up a lot. Luckily, we sort of know how to answer them and are ready to go, but for those kinds of questions. But having that data to be able to show, exactly what's happening in neighboring states can just be very valuable in those conversations.
I'd like to take the opportunity to thank our speakers, Brandon Kenemer, Lucy Culp, and Desmond Jenson, and to encourage you to visit the resources on the CDC state website, its OSH data website, and our website at the Public Health Law Center for additional information. Please feel free to contact us for additional, if you have additional questions. So thank you very much for attending our webinar.